Hey, this is QD Video brought to you by Room Now Live. Can't get to Fort Worth on March 22? Well, you don't have to. We've reserved a virtual seat for you. You can register at roomnow.live and we'll stream the video to you and your desktop. Today's case is called Dysgeusia. Can you spell Dysgeusia? Can you use it in a sentence? Well, let me tell you about Dysgeusia. A 58-year-old woman with rheumatoid arthritis comes to see me, and after making the diagnosis, we put her on methotrexate. She does well, but she's got problems. She's got oral ulcers, she's got a little queasiness, she feels blah-like for a day and a half afterwards. We put her on vitamin A and also on dextromethorphan. If you don't know that story, tune in for other videos and I'll talk about management of methotrexate toxicities. Actually, I think I've already done that, called Optimizing Methotrexate. Anyway, she comes back a month later and she's doing well, she's doing better, she has no more side effects, but she has this problem of dysgeusia, an abnormal, unpleasant taste in her mouth. Seems to be accentuated after the methotrexate, but it's kind of there all week long. Dysgeusia, D-Y-S-G-E-U-S-I-A. It's also called parageusia. It's the word you would use for someone who has metallic taste due to a drug or a bad taste due to drugs. Is it due to the drug? Is it due to a disease? What's the deal? Is it due to methotrexate? So again, not knowing what to do here, I was not aware that it would be due to methotrexate, and I've looked it up and I really don't think it's due to methotrexate. But I had to look up dysgeusia and learn more about it. It's actually also called parageusia. These are really bad names. It's really hard to spell. I used to live in Parageusia. I moved to Dysgeusia, but that was displeasing, and so now I'm back in Dallas. But dysgeusia, again, is a problem for the patient. And so this patient wants this abnormal taste to go away. So what did I do? I told her, hold the methotrexate, go back on a lower dose, and her arthritis can survive being off methotrexate, and we can answer the question about whether it's methotrexate. I don't think it's due to methotrexate. You need to think of other problems, dental problems, upper respiratory tract infections, sinus infections can all be important causes. It's often associated with mental illness, and that's a problem in distinguishing it from true organic disease. It's often related to drugs, antibiotics, the metronidazole, clindamycin, fluoroquinolones, thyroid therapies, methocarbamol. Of the drugs that we use in rheumatology, the ones that are most commonly associated with dysgeusia includes penicillamine, levamisole, gold, levodopa, we don't use those, methocarbamol, I think I mentioned, and then of course Lunesta. A common side effect of Lunesta is a metallic taste. Methotrexate, not so much, but let's see what happens with this patient over time. You also need to consider the patients who have dry mouth and poor saliva or abnormal disordered saliva flow often complain of dysgeusia, and so it's not an uncommon feature in patients with Sjogren's syndrome. The differential diagnosis is also long. It involves neurologic disease, multiple sclerosis, GERD, hepatitis, even diabetics, and think about deficiencies of either zinc, mercury, or copper. My partner's got a case of zinc deficiency with dysgeusia. Who'd have thought it? Anyway, it can be a problematic symptom, especially in managing RA. We'll see what happens with my patient. I don't think it's going to be due to methotrexate, but then again, I'm not sure what it's due to. Maybe you can tell me. We'll see you in Fort Worth.